Спасибо. Good afternoon, dear students. Please, will invite me and will say in the chat how about hearing. Can you hearing me or no? How about quality of picture? Please write down in the chat. Okay, I can see some students present, but dear students, hurry up, connect please to the lecture, and we will start now. Please will write down how you can hearing me and about quality of picture in your screen. Dear students, please will write, can. Very good. No, okay, I am glad. The quality of sound and pictures is normally, да? Correct, understand? Some students write down it's correct. Okay. Dear students, today now will be third lecture about medical rehabilitation. The name to the lecture is Pathology in Sports, Rehabilitation Medicine in Sports, the Concept of Doping. Purpose of the lectures: to generate at students a presentation about pathology in sport, rehabilitation medicine in sport, the concept of doping. Question for discussion are medical control of people involved in the physical education and sport, pre-pathological condition and disease arising from irrational physical culture and sports, pathogenetic syndromes in sports medicine, their treatment and correction, and the concept of doping. These questions we will discuss on the today lecture. If you remember from previous lecture, physical culture is the component of general culture of the society representing the whole complex of material and cultural with created by mankind during public historical development. Components of physical culture are the big sport, health improvement, physical training, and exercise therapy. If you remember from previous lecture, when we have conversation about sports medicine, I said the main task of sports physician is a recommendation of a rational physical training. Physical training which improve health of participation, improve health of athlete, and prevent disease. But, dear students, irrational physical training, non-optimal physical exertion can be reasons disease, can be reasons pre-pathological and pathological condition of athlete, and unfortunately sometimes can be reason of diet person who have physical training. The reasons of occurrence of disease in sportsmen, it is necessary to divide into two big groups. First group, it's non-connected to occupations by sports, to the reasons which have been not connected to occupation by sports or influences of an environment. It can be epidemics, for example, epidemic new coronavirus infection, COVID-19, influence, etc. Cooling, different weather, infection, disease, can be bad habits, dear students, for example, smoking, drink alcohol, takes narcotics, druggers, can be reason different pathological condition of athlete. Bad nutrition also, not rational nutrition. Did you remember when we discussed previously lecture different different reasons of disease and diagnostic technology. It's very important to review it in the anamnesis of athletes these questions about previously disease, about rationale of nutrition, about bad habits. It's help us in the correct diagnostic of physical training. Okay, other big group of reasons, pre-pathological and pathological condition of athletes, it's connected to occupation by sport. This group can be divided into two groups. First group, the reasons dependent on the wrong organization of training process. Irrational use of means and methods of training, absence or an insufficient individualization of a degree of the physical loading resulting in an overload and an overstrain concern to the first group. Its reasons can avoid when sport physician provide strict medical control, physical training, provide medical pedagogical evaluation of athletes, and have adequate knowledge about sports medicine. What you will study and are studying in our department, and if you will study our discipline good, you will have this knowledge and you have competition for provide control and recommend rational physical training. Some bit late we will discuss the main methods of medical pedagogical evaluation. Okay, second groups of reasons disease parapathological condition of athletes. It's the disease that arises in sportsmen and the correct organization and a technique of training enter to the second group. For example, dear students, it can be using of doping. Doping, it's very harmful, very dangerous chemical substance. It's banning chemical substance. illegal chemical substance, which can be reasons different prepathological and pathological conditions. Or, for example, when person have any latent disease, and have dissimulation, not use help of sports physician and other physician. In this situation, this disease can develop and appear seriously complication. Okay, how about prepathological conditional and disease at irrational occupation by physical training and sport? No, in first of all, it's fatigue. No, fatigue, it represents physiological reactions to loading and passes after the certain rest. Distinguish 3 degrees of fatigue: weak, mild, and expressed. It is clinically shown by hyperemia of integument, perspiration, tremor of extremities, and disturbances of movements coordination. This as usually physiological reaction. It's not prepathological reaction. Fatigue can be prepathological reactions if athletes haven't adequate rest, haven't adequate regime of training, and fatigue can transform in the over fatigue. Represents an extreme degree of fatigue. This condition, besides long rest, demands use of various regenerative actions. If athletes have over fatigue, it's first step for formation pathology. It's prepathological condition. Why have named prepathological condition? Because haven't any morphological changes in the tissues. Have named prepathological. Next step in the progress over fatigue is overtraining. Is overstrain of central nervous system and have manifestation as neurosis of various degree expressiveness. Next, it's stadium when formate different morphological changes and prepathological condition transform in the pathological condition. It's overstrain. It's shown by precise and concrete changes in the various organs and is usually separately in any one organ and sometimes simultaneously in various organs. The overstrain of heart, kidneys, bones exists and is investigated enough. Overtraining is the pathological conditions which clinical pictures is defined with functional disorder in central nervous system. As neurosis, I said to you. What is pathogenesis? Overtraining develops as a result of summation of repeatedly arising over fatigue. In a basis, the overstrain of process of excitation and inhibition in a cerebral cortex that allows to decide pathogenesis of overtraining similar to pathogenesis of neurosis. How about clinical pictures? In clinical practice, reveal three stages are distinguished, and they proceed more seriously in the young men than in the children. The first stage is characterized by absence of complaints or complaints to the disorders of sleep, insomnia, sleeplessness maybe, reduction of productivity. Maybe athletes have apathy, sleeplessness, can be only one complaint. Disturbances of the coordination of movements and deteriorations of cardiovascular system adaptability to high-speed loading. It can be tremor of extremities, increased arterial pressure. The second stage is characterized by numerous complaints, functional changes in internal organs, reductions in the sports work capacity, apathy, flaccidity, sleeplessness, nervousness, increased emotions, fear, unpleasant sensation in the region of heart are prevalent among complaint. Objectively, we can determine the pallor, the sunken eyes, bluish color of lips, disorder of sleep, appetite, symptoms of autonomic disorders, autonomic dystonia. The third stage is characterized by sharp deterioration of sports result and can be as two forms: Basedow-like disease and Addison's-like and Addison's disease. Dear students, how about objective diagnostic overtraining? It's really a large problem. Why? Because if we will use traditional forms of diagnostic during takes time, anamnesis takes external examination or maybe physical examination, use additional method investigation, ECG for example, or encephalography, or maybe computer scan, cardiography, blood test. Dear students, cannot find any problem, cannot find any pathological changes in this analysis. And dear students, appear seriously problem in the professional sport. And first of all, when athletes have too many complaints and objectively cannot prove person have disease. How should it's problem of athlete and problem of professional team. It can be simulation. For example, athletes don't want have work, don't want take part in the competition, for example. But it's problem for team, for sports team. It's one moment. How we can provide differential diagnostic? It's simulation or it's really start and have development pre-pathological conditional. It's very important. If we not review this on the early stage pre-pathological condition, very soon appear pathological conditional. A pathological conditional can be reasons invalidization of athletes and can be reason diet of athlete. What should do in this situation? Dear students, we have very good diagnostic technology for objective clinical investigation and reviewed correct diagnosis. If you was attentively on previous lecture, I said this diagnostic technology is functional test. Dear students, do you remember 2 weeks ago we have had conversation about this. If we will provide simple, cheap, functional test, for example, Martinez-Koshulevsky test, or clean orthostatic test, or orthostatic test, we can review this problem with nerve system, problem with cardiac system, and we can correctly diagnose overtraining, complaints, anamnesis, plus objective results of functional test, stress test can help us in the correct diagnostic. And athlete survive, athlete avoid of invalidization, avoid diet. Do you understand? Avoid of pathological process. Please remember about this. It's very, very important knowledge. Okay, if you provided correct diagnostic and determine overtraining, what should do? How about treatment? No, in first stage, we must decrease physical exertion for person. Training does not present in the first stage. However, the sportsman is removed from competitions. The regime of training is facilitated till 2-4 weeks or take up overloading, massage, recommend sauna, multivitamins are prescribed. It will be enough very often. In the second stage, the regime of second stage of our training, you understand. The regime of trainings also is facilitated or removed from trainings for 1-2 weeks, and active rest is appointed. Also recommend massage, sauna, multivitamins are appointed also. In the third stage of overtraining, the training is necessary to stop for 1-2 months. 15 days from them are removed on full rest and treatments which should be spent in clinical condition. After that, to the sportsman, active rest is appointed. So, clinical conditions, it should be medical rehabilitation centers, as usually understand that. Medical rehabilitation in the restoration function of athletes become the most important. As usually recommend multivitamins, special diet. Very often it will be enough. No, can recommend massage, different variant of balneotherapy with essential oil. Dear students, nature essential oil have many positive effect on the restoration, different function in the athletes. Now very widely used for prophylactic and for treatment person with use aromatherapy. But balneotherapy combine effect of hydrotherapy with treatment effect, rehabilitation effect of nature essential oils. It's new direction in the sports medicine and have large perspective. Okay, dear students, overstrain. It's seriously situation. The overstrain, it's already pathological process. Acute can be chronic physical overstrain. APO, acute physical overstrain, and CPO, it's abbreviature, short name, chronic physical overstrain. The acute and chronic physical overstrain is etiological factor causing development in heart of myocardium dystrophy and necrosis on rare cases, hemorrhages in myocardium, and myocarditic cardiosclerosis. In pathogenesis of acute physical overstrain, lay down the theory in which the leading place in development of myocardium injury and dystrophic process vegetative nerve system has experimentally proved. In pathogenesis, APO and CPO, chronic physical overstrain, has meaning the changes in the central nerve system, endocrine system, and also hypoxemia, hypoglycemia, spasm of the coronary vessels, developing of overloading. How about clinical pictures of acute physical overstrain? Acute dystrophy of myocardium is developed after physical overloading or during its performance. There is acute fatigue, vertigo, dyspnea, palpitation, heavy feeling and pressure in the field of heart, muscular weakness, quite often as nausea and vomiting. In heavy cases, loss of consciousness and acute cardiac insufficiency. In cases of development of hemorrhage in cardiac muscles, heart attack, with apparent acute pain in the field of heart, cyanosis, cold sweat, falls down arterial pressure, collapse, dyspnea, and pulsations of jugular vein. On an electrocardiogram can determine diffuse changes in the myocardium of ventriculus, sharp arising impressions of the wave T, P, lengthening of the electric systole and anteroventricular conductivity, disturbance of heart rhythm, extrasystole, incomplete blockade. Treatment. This doubt. Now I will demonstrate you. It's variant of myocardial dystrophy in the modern international classification of disease. It have name myocardiopathy of athlete. Another name. You can see on the first line the norm of ECG part in the different leads. First and second, third and AVF, V2, V3, V4 and V6. And different changes which I discussed, explained to you during first stage dystrophy of myocardium, myocardiopathy, second stage, and third stage. You can see every time these changes is more severe. Now you can see different variant of arrhythmic changes. Hypoxemic changes, arrhythmical changes in the athletes with myocardial dystrophy. It's myocardial cardiosclerosis and hypertrophy. It's pathological hypertrophy of heart appear in the persons with chronic overstrain. Sorry. In the upper picture is hypertrophic heart. Low picture is normally heart in the X-ray during X-ray examination. It's variant of hepatosclerosis. The one of symptoms of damage of liver can be pain syndrome in the liver during physical training, which very often connect with pathology of liver. For example, chronic hepatitis can be toxic or can be virus hepatitis. can be steatohepatitis, and when if connect with chronic overstrain, can be reasons for made different sclerotic changes in the liver and dysfunction of liver. And for example, if it's boxers where present chronic trauma of liver, can be formate sclerosis, can be formate cirrhosis of liver. How about treatment? Treatment these conditionals. No, first, second stage should be passive rest and using of cardiac medicines. It's cordiamine, caffeine, yes, if there are collapse, different metabolic agents, for example, meldonium, reductao, thiotriazoline. This preparation improve metabolic process, prevent hypoxia of myocardium in combination with multivitamins and vitamins can improve metabolic process and help more fast regeneration of heart. Now understand 1-2 weeks its absence of training should be active rest or exercise therapy. Medical physical culture can combine with physiotherapy, for example, magnetic wave therapy, maybe hydrotherapy. How also good, for example, with lavender essential oil, Shalfei essential oil, give very good effect on cardiovascular nerve system, help more fast restoration. Can use massage. As usually use weak massage, not vigorous massage. Chronic disturbances and overstrains of a locomotor system. During sports activity, there are very often disturbances of muscles and muscular ligamentous system. Micro disturbances, a particulate disruption, the foul disruption, and acute muscular spastic structure, myalgia, myelogenosis, myofibrosis, neuromyositis, ossificing myositis, paratendonitis, tendinitis, tenovaginitis, myotensitis, bursitis. The most widespread disease of joints which are met in sportsmen is arthritis, synoviitis, periarthritis, and arthrosis. On this picture, you can see the gymnastic athlete in result of chronic overtrain appear osteopenia in the bottom pelvic bones, pubic joints, arthritis. As usually, this person has had complaints on the pain in this area, pubic area, and problem with movements, limitation of movements. In this situation, also, it's runner. You can see particularly disruptor in the femoral bone, muscles during strength contraction have disruptures and damage of bones. That you can see one of pad bones disrupted. It's disrupted. This is formation of arthrosis. Picture illustrate this X-ray examination. You can see that decrease in the joint have manifestation inflammatory process, chronic inflammatory process, this dystrophic changes in the joints. It's arthrosis on the ankle joint. Person who have tennis athletes. It's specific professional problems. Also connect with irrational physical training and overstrain, chronic overstrain. Here you can see arthritis, knee joint. In the knee joint, in the tibula, formate osteonecrosis, the disease Osgood-Schleiter disease. It's also complications, chronic overstrain. It's variant of arthrosis down the knee joints with dislocation. It's variant of arthritis of athlete. It's footballist. Athletes have complaints on the pain in the knee joints and limitation of movements, and after investigation provide diagnostic of chronic overstrain and arthritis. How about prevention? How about treatment this problem? As usually provide medical rehabilitation. Provide medical rehabilitation in the combination with pharmacological therapy. Must stop training and use sports traumatologists, sports physician take part and neurologists also take part in the treatment of this problem. How about pharmacological preparation? It's non-steroid anti-inflammatory drugs can use steroids, hormones for treatment, different injection, can use chondroprotectors, chondroitin sulfate, for example, glucosamine. It gives very good result for treatment this pathology, but also must combine treatment and rehabilitation of this person with different methods of medical rehabilitation. For example, manual therapy, electrotherapy, ultrasonic therapy, hydrotherapy, laser therapy, heat therapy, cold therapy. But, dear students, all this method is expensive and have side effects. Pharmacological preparation, non-steroid drugs, steroid hormones. But how we can prevent these pre-pathological and pathological condition of athletes? I will repeat. Should provide medical control, represent the independent medical discipline. Medical supervisions means regular coordination, direction, inspection by a physician of an individual's exercise of delegation to delivery medical services when the individual is not licensed by administer medical service. Clinical supervisions of health professionals is associated with effectiveness of care. The review found significant improvement in the process of the care that may improve compliance with processes that are associated with enhanced patient health outcomes. All diagnostic technologies which we discussed previous lecture used in the medical control for reviewed in, first of all, latent disease, if you remember, which can be reasons of different complications. Do you remember? I explain you example. If person without adequate medical evaluation start physical training, it can be reason for many different problems. For example, that one didn't pass stress test, functional test. Person with first functional class of angina pectoris and start any physical training, for example, running, without previously strict examination. First functional class, the symptoms of ischemia disease of heart, angina pectoris, manifestate only after 900 meters of fast walking or climb on the steps, step on the fourth law. Many people in the modern world haven't this this terrible physical exertion. Why? Because have car, marshrutka, bus, trolleybus, elevator, and can live and don't know about angina pectoris. And now, unfortunately, very often angina pectoris is reviewed in the young man. I understand why, because it's connected with hypodynamia and not having healthy style of life. But this person, for example, have decision. I want will be beautiful, have a good strength, and start, for example, running and run without medical control, without medical supervision and previously medical evaluation. What can happen? On the after 900 meters, running appear symptom of angina pectoris. It can be pain in the chest, can be breathlessness, and without this, as usually people don't know about these symptoms of disease. They maybe think, okay, this is symptom of maybe result of physical exertion. I will continue running or any physical exertion, step climbing, for example, and result this appear problem, appear infarction myocardium. Next step in the ischemia disease of heart, after angina pectoris, infarction myocardium. After ischemia appear necrosis of myocardium. It's seriously disease. 15%, 15-20% different statistic. It's diet of person, rest, 75-80%, 85-80%, person become invalids. Do you understand? Appear pathological process in result of physical training, sports activity. It's very bad. We shouldn't prevent this. Use knowledge about sports medicine, medical control. Okay, it's understand. What else? What else? We said one of reasons formation prepathological conditional is not correct dose of physical training. In result of medical evaluation, we must recommend for prophylactic prepathological and pathological conditional of athlete rational individual physical training. Please remember about previous lecture, and we should recommend person who have good or satisfactory physical development, or haven't any disease or have small deviation from normal. For example, obesity first stage, or maybe the myopia light form. It's insignificant deviation from normal state of health. for this person that have sufficient physical development and normal or sufficient physical fitness should recommend basic medical group. In the basic medical group can be all types of physical training, physical in full. Can be, should be intensive physical training. Person can have employment in the sports section, participation in competition, sports competition. During physical training class, this person can have normatives without any limitation. Is it clear, dear students? In result of medical evaluation for persons with insufficient physical development and weak physical preparation, without deviation and or insignificant deviation in the state of health for healthy person, or with small deviation from normal. I repeat, that person with astigmatism, light form myopia, first state of obesity, of deficit, light form deficit of mass of body. We should recommend preparatory group for physical training. Employment under curriculums of physical training under condition of more gradual development of a complex of impellent skills and the skills especially connected with presentation to an organism of increased requirements. Additional employment for increase of a level of physical readiness. In other words, for this person, contraindicate intensive physical training, but mild moderate physical training must be. Contraindicate for this person sports section. Contraindicate participation in the sports competition. No, maybe exclude chest. But physical competition which connect with intensive physical training contraindicated usually. During physical training class, person with preparatory group can have normatives, but its normatives less than person in the basic group. Dear students, now I explained you individualization of dosage physical training. Its prevention, pre-pathological and pathological condition also. Person who have physical training, big sport, or maybe physical training for improved health, or exercise therapy. Okay, person who have disease, chronic disease, in the stadium of remission, we must recommend special group. Employment under special curriculums that during admissible physical loading that contraindicates intensive physical training, sports section, takes part in the sports competition, but recommend exercise therapy for secondary prevention different disease and complication of disease. You know, firstly, prophylactic prevention, it's prevention any disease, but second prophylactic, it's prevention complication exist disease in the person. Please remember about this. You can ask me, what is different with person special and preparatory group? Yes, it's person in the preparatory group should by step increase intensity of physical training. And the aim purpose training in the preparatory group, it's improve physical development and fitness of person, tolerance for physical exertion. When we can change group for this person on the basic, it's improved person, improve health conditional, and our tactic and strategy of physical training was correct. Who provide physical training in the basic, preparatory and special group? As usually, physical training provide persons with pedagogical educational, sports educational. This means, but there are also one additional group which have a name, medical physical culture group. In this group, we recommend training for person with chronic disease in the subacute stage, persons after acute disease in the period of restoration, rehabilitation period, person in the rehabilitation period after trauma, operations, pregnant women, and or maybe after labor, women for after labor, and recommend physical training for person handicaps, person with invalidization. In this group, provide exercise therapy, medical, gymnastic, and provide training as usually person with medical educational and special skills, sports physician, physiotherapeutics maybe, or nurse help now, which have also medical educational, physiotherapy educational. Okay, other methods, prophylactic, pre-pathological and pathological condition of athletes, it's medical pedagogical observation. Other investigations conducted both by the physician and coach teacher, physical training teacher, sports trainer, to estimate the force of physical loads on those going in for physical culture and sport to perfect the planning of the study training process. Medical pedagogical observation helps in the collecting complete information about the athletes in the course of training, which is required for the corrections of the training process, and optimize post-physical stressing recovery. Task of medical pedagogical observation: studying of conformity of conditions of employment to hygienic and physiological norm. Definitions of influence of employment or competitions on the organism. The analysis of a level of the general readiness and special training. The help to the teacher in correct planning of employment during physical training and sports training, with the purpose of finding out that these influences it is accepted to study the urgent set aside and cumulative training effect. Did you remember in the start of lecture we said about reasons of pre-pathological conditionals? What correct organization of a regime of training, enough rest, individualization of physical training, help prevent pre-pathological and pathological conditionals. Medical pedagogical observations spent during stage every 2-3 current month, current daily and operative to day of training in the morning and the evening time. Researchers. During medical pedagogical observations, use following methodical receptions. Definitions of employment density by chronometry. Actions engage persons is defined the general time spent for physical exercise. The density it is relations of time of performance of exercise to general time of employment in the percent. Definition of physiological curve of employment by a pulse recording and blood pressure in dynamics of training and constructions of the diagram. Analyzing a curve, it is possible to estimate efficiency of an introduction, basic, and final part of training. Dear students, all training have introductions, in another name have warm up, basic part, and final part, cool down part. And you understand that blood pressure and pulse rate minimum should be during introduction and final part, and maximum during basic part. Also determine degree of recovering on investigate parameters. How fast will be a recovery organism after physical exertion. An estimation of the degree of fatigue to external attributes. It's 2/4 of integument's a sweating and accuracy of movement. Also, sports physician must control the age of young athletes, children's, when these children's involve into sports activity. Too early involved in the sports activity also can be reasons pre-pathological and pathological condition of athlete. Dear students, in this table you can see the optimum age for initiation, participation in the different kind of sports in years. Okay, for example, for badminton it's from 10 to 12 years, specialization is from 12 to 14 years, basketball Same. Boxing from 12 to 14th year, and age of specialization should be 14, 15 year. Cycling from 12th, 13th year, specialization 14th and 15th year. Gymnastic from 7 to 8 years, specialization 9 to 11. Mountain skiing, it's from 8 to 10 years, specialization 10 to 12 years. Handball 10 to 12 years, specialization from 12 to 14 years. Tennis from 7 to 9 years, specialization from 9 to 11 years. Weightlifting from 13th year students, specialization from 14 to 15. Figure skating from 7 to 9 years, specialization from 9 to 11. Football and ice hockey, it's from 10 to 11 years, specialization from 11 to 12. And soccer. It's very important information for future physician and for future parents, dear students. I'm sure you will have children, and if you want that your children's will be healthy and smart, you must recommend systematic physical training for them. But this table help you in correct recommendation of physical training. Okay, dear students, one of other reasons that pathological and pathological problem of athletes, it's root terms of renewal of employment by physical training and sport after disease. Not correct recommendation for restart physical training after disease. Athletes, it's also people who have disease, but dear students, for prevention pathological conditions, athletes starts off intensive physical training after different disease must have break time. What, for example, for tonsillitis, it's from 2 to 4 weeks. From bronchitis, it's from 1 to 3 weeks. Acute otitis from 2 to 4 weeks. Pneumonia from 1 to 2 months. Flu from 2 to 4 weeks. Acute infection, and it's 1 to 2 months. COVID-19, same situation, new coronavirus infection. Please remember about this. Acute pyelonephritis, dear students, from 8 to 12 months should be free from intensive physical training. Viral hepatitis, from 1 to 2 months. Appendicitis, from 1 to 3 months. Fractures of bone, from 2 to 12 months. It depends from types of brain concussion. Also some months should be contraindication for intensive physical training. Future physician must know this period breaking of physical training. And students also, what you also take part in the physical training classes. But remember, for prevention different complication from physical training, if you had any disease, you must period particular period when physical training is contraindicated for prevention of prepathological and pathological conditions which connect with physical training. Please remember about this. Okay, dear students, some words briefly about different urgent conditions in sports. Syncope, acute disturbance of a tone of brain vessels or because of short-term cardiac arrest and change of cardiac emission. It can be result of latent disease, dear students, or result of overstraining, you understand. A gravitation shock at a sudden stop after intensive loading, sharp change of return of blood for heart. Orthostatic collapse after sharp change of position from prone position to vertical of a body due to reduction of venous return to heart. Dear students, it also can be result overtraining, overstrain. Did you remember in previous lecture? Orthostatic test. We must provide this test for recommendation physical training for prevent this problem, the orthostatic collapse. Understand, during orthostatic collapse, person can lose consciousness and fall down and can have vertigo, problem with coordination, and fall down and have trauma of head, for example, intracranial hematome and died, or maybe trauma of spine. It can be invalidization. It's very serious problems. Please remember about this. Next, a phenomenon of static effort strain at weightlifters because of a sharp increase of intra-chest pressure and reduction of inflow of blood to heart that result in an asphyxia and loss of consciousness. It is still observed at boxers at the punch in the solar plexus. Next, reflector cardiac arrest. At a knockout boxers, at football players, at receptions of a ball and the breast. No, how about emergency aid, dear students? Provide artificial respiration and external massage of heart. Next, it's symptom of coronary sinus. At a sharp punch in the neck and boxing, wrestling, at failing, thus reductions of arterial pressure up to zero and reflector cardiac arrest and observe. Understand, its reanimation should be in this situation now with injection of adrenaline, epinephrine, cordiamine, and other. What else? A painful shock. Wrestler during footballs or maybe boxing, karate, in result of any trauma. What should do in this? Painful shock. Must be injection of narcotics and other animation. Hypoglycemic shock in the kind of sports of endurance as usually appear marathon athletes, for runners long distance, stars runner. How we can treat? Very simple. If it's person can drink water, we will give any water with glucose or give them candy, sweet tea, tea with sugar, or maybe any juice with sugar, or if it's not possible, it's intravenous injections of glucose, 40%. Next, hypnotic condition, loss of orientation, heat stroke. It's very often appear, this problem. You know how can help of that. Arrhythmia. It's provide defibrillation should, and usually in seriously competitions should be defibrillator and provide injections antiarrhythmic drugs. Spontaneous pneumothorax conducts to a painful shock. It's winter kinds of sports is usually possible. You also know how can help person. Gastric spasm or runner's diarrhea can be. Tonsillocardiac syndrome, pains in the heart. Hepatocardial syndrome, acute pains in the field of liver. Hysteria can be also. Dear students, please remember, should be always medical control, place where provide training, physical training, competitions for provide emergency aid this person, this conditional. Please remember this, and you must know how provide correct treatment these dangerous urgent conditionals in the sports. Okay. Also use after trauma operative treatment and rehabilitation person. And now you can see the algorithm of post-operative rehabilitation, medical rehabilitation, which can help person return to the sports. Use different methods of medical rehabilitation, massage, therapeutists, physiotherapeutists, occupational therapists, chiropractors, osteopaths, and osteopathic physicians to treat musculoskeletal pain and disability. It includes mobilization manipulation. Now you can see this in the picture. It's a variant of electrotherapy, and use electric current, which help have anti-pain, painkiller effect, can stimulate blood circulation, decrease spasm of muscles. Very good effect, without negative effects, side effects, which have different drugs. Ultrasonic therapy, and use ultrasound for treatment, can use ultrasound pharesis, different preparation. Hydrotherapy, also many positive effects for increased range of motion in the joints, decrease muscle spasm. It's help more fast restoration after sports trauma, after for a person with overtrain. Laser therapy, variant of phototherapy, use laser radiation. It's a very good traffic effect, restoration effect, painkiller effects. Heat therapy, same situation. Or cold therapy, ice therapy. It's used how for treatment acute trauma, for decrease of edema, decrease pain, painful sensation, and also for treatment chronic dystrophic process. It have anti-inflammatory effect and such. On other lectures, on the 6th lecture, we will discuss the different technology of physiotherapy more detailedly on 5th and 6th lecture. Treatment of this disease and preventive maintenance is by possible early revealing of the prepathological condition connected to irrational employments, occupations by sports, overdose of loading, trainings, and occurrence of somatic disease. Please remember, dear student, this and use this knowledge in your medical practice. Okay, dear student, doping. We said that doping is one of reason for pathological and pathological condition of athletes. In sports, doping refers to the use of performance-enhancing drugs, particularly those forbidden by organizations that regulate competitions. Doping is mostly done to improve athletic performance, which is why many sports ban the use of performance-enhancing drugs. Doping is considered unethical mainly due to the health treat or performance-enhancing drug, the quality of opportunity of the athletes, and the exemplary effect of clean, doping-free sports in the public. No, if said towards the doping is used for banned athletic performance enhancing drug by athletic competitors. Performance enhancing drug is another term used for drugs used by athletes to improve. On this picture you can see different types of doping which use in the sports practice, and different negative effect from doping. You can see here 7 groups, but dear students, every year edit new group of dopings. For example, in this group also use now, unfortunately, the substances which improve metabolic process in the heart. It's meldonium you're hearing, and thiotriazoline, Reductal. It's also preparation now have name in the sports doping, but dear students, it's one exclusion from rules. These substances haven't side effects opposite this pharmacological preparation can prevent different problem with cardiovascular system and musculoskeletal system of athletes. Now, what's the group? It's stimulants, caffeine, amphetamines, cocaine, develop of muscle bone. It's anabolic steroids, beta-2 antagonists, human chorionic gonadotropin, luteinizing hormone, human growth hormone, insulin-like growth factor 1, insulin, peptide hormones, and boost oxygen delivery. It's erythropoietin, blood doping, artificial oxygen carriers. Mask pain, narcotics, analgesics, adrenocorticotropic hormone, cortisone, local anesthetics, relaxant, alcohol, and other. Diuretics are drugs that affect the kidney, which increase the amount of urine production and excreted. There will be a loss of salt and water through the urinary tract. Diuretics are mainly used to ease hypertension, to treat acute and chronic heart failure, and treat fluid retention. The negative side effects are dizziness, upset, stomach, rash, kidney dysfunction, salt and water imbalance, dehydration, hypotension, metabolic alkalosis, renal dysfunction, impotence, and cold. The students, diuretics necessary, first of all, in the sports practice for decreased body weight, for change weight category during sports competition in the, for example, boxers, weightlifters, fightings and other. It help be champions of person, but you can see different negative effects of diuretics. Now this picture illustration illustrate different negative effect on the different organs, different doping agent. Erythropoietin, APO, a hormone secreted by the kidney that stimulates the bone marrow and increase red blood cells production, thus increasing red blood cells mass, hemoglobin and hematocrit. In sports recombinant human erythropoietin is used, APO is used to treat deficiencies such as anemia caused by kidney dysfunction. The negative side effects are hypertension, abdominal pain, pus accumulation, arm, back, jaw pain, blurred vision, breathing difficulties, chest pain, chills, confusion, cold, producing mucus, fainting, vomiting, irregular heartbeat, and many more. Viscosity of blood increase, thromb productions appear, and result these appear infarction of myocardium, brain stroke, thromboembolism of lungs, artery, and different dangerous complications. Stimulants. Psychostimulants or sympathomimetics are chemicals derived from adrenaline which affect the central nervous system directly as they increase the activity of the brain and the body. Stimulants are normally used to stimulate activity of the heart, then the heart attack occurs, they stop the heart and used as antidepressants. The effects that can develop are rapid heart rate, palpitation, hypertension, chest pain, respiratory suppressions, vomiting, hallucination, delirium, aggression, psychosis, muscle cramps, suicidal tendency, memory loss, fatal kidney lung disorders, liver damage, stroke, permanent psychological problems, etc. Dear students, very dangerous preparations there. Anabolic steroids, a hormone that are similar to the male sex hormone testosterone. Testosterone induces growth and development of muscles. Anabolic steroids is used to build up muscles. The effect of anabolic steroids are insomnia, vomiting, sterility, sexual dysfunction, body hair, birth, deep voice, interrupted menses, coarse skin in the woman, feminine breasts, and shrunken testicles in men, brain damage, cardiovascular damage, liver damage, kidney disease, and psychological damage. brain stroke, infarction, myocardial, dear students, hypertension disease, also the infertility, impotence, and cancer disease also, dear students. It's result using of these pharmacological substances. But this means, dear students, impotence, dies usually, and have many problems with health. Ladies become same with men, and also have sexual problems and different problems with somatic and psychological health. Narcotic analgesics are drugs such as morphine, methadone, petidine, and buprenorphine that are used to reduce pain, sedation, and treatment of terminally ill patients. Narcotics are used by athletes to perform while injured. The effects of narcotics are addiction, then pain responses, lethargy, blurred vision, reduced respiratory rate, and stop respiration, asphyxia and diet of person, vomiting, constipation, anxiety, or fear and loss of concentration. Terrible side effects. Now you can see how often use athletes different doping groups. The first place took anabolic steroids, stimulants 48%, stimulants 15%, masking agents it's 13%. Masking agents, one of them is diuretics, dear students also. Glucocorticoids 8%, metabolic modulators 5%, other 11%. For review doping using of athletes, use doping test, dear students. WADA, it's special organization that in sports committee provide fighting with using of doping. Doping is a legal pharmacological substance. And for determination doping, use different labor tests. For drug is essentially the scientific procedure to investigating body fluids for the occurrence of banned substances, and the first doping tests were done using saliva. Now use urine, saliva, blood, if during investigation finding any doping, as usually provide punishment for athlete, and also can be punishment for team and for country, can be seriously punishment. It's prohibition using flag, different symbolic of country during Olympic game, championate of world. Example, one of these fighting, it's problem Russian sports team on the Olympic Games, but other teams, sports team from United States of America, UK and other countries that usually have also many cases using of doping, but also have punishment, but not strict. For Russia was too strict. What is conclusion, dear students? Don't use doping in your life. It's very dangerous. It have many side effects, and no recommend for other person who have physical training Okay, dear students, thank you for attention. Goodbye. Good luck, dear students.